Are you in a hospital that's gotten these notices? Give us a call. I mean, it's confirmed. We're not asking you to confirm it. Give us your take on it. Dr. Davis in Florida wants to give us his take on this. Go ahead, Dr. Davis.
I think it's ridiculous to bring these patients back. It introduces risks that are just not reasonable. And like you said, you can put a level 3 containment facility on just about any Navy ship and keep those people away from the rest of the population. It only makes common sense.
Why do you think they're bringing so many Ebola patients back to South Dakota and Georgia and other states?
I can't even speculate because it makes absolutely no sense. Like I said, it creates risk where you don't have to have risk. It just doesn't make any sense.
What's your overall view of the Ebola epidemic?
Well, I think that from my perspective of running a biotech company that has a potential solution for this in a drug that we've developed and worked with the Army on it, all of the emphasis right now appears to be on vaccines. And I think that that's a mistaken solution because if you have hypermutation like you have in this particular viral strain, it's impossible to anticipate how it might mutate, which is the key to developing a successful vaccine. You have to look forward at where it's going to go, and you can't predict where this is going to go. So I don't believe that the vaccines that Glaxo or any of the other companies are trying to work on, even though I believe in those from a scientific standpoint, I simply don't believe that you can predict where this will go in order to make enough vaccines that'll make a reasonable protection for the population.
Sure. Well, you've been a guest on the show before. I'm glad you got in today. You ought to write an article for us about that and send it over. We'd like to get your perspective on why an Ebola vaccine won't work at this point. Thank you so much for the call. Sean in Nevada is a doctor, works in an emergency room. Sean, thanks for calling in. Give us your take on the situation.
My take is that we may be dealing with something more than just spread by, bodily fluids. We get a CDC announcement today that you need to have a respirator, you need to have basically a level 3 biosuit to engage with these patients. That's becoming concerning to me that the CDC sends something out like that. Unfortunately, they can lag in their response to different infections. And then in the state of Nevada, if you're a licensed physician, you get notifications through the sort of infectious disease gurus out of Vegas, and they are now sending out a warning sheet of what to look for in patients who may have Ebola. And as far as I know, there are quote unquote no reported cases of Ebola in the United States.
But now, because it takes weeks for it to show up before you know somebody's sick, I guess that's why they're doing this.
Well, my concern is that do we have a bunch of little time bombs walking around the streets of America that are going to suddenly explode and we're going to suddenly start having cases? And it certainly doesn't help, like Dr. Davis suggested, bringing in infected people, because none of us really train for dealing with this level of infectious disease. It's not commonplace for us to down up and deal with patients of this caliber in our emergency rooms here in America. And so it's really concerning that it's probably going to walk into one of our emergency rooms one day, and you're going to have staff that are going to be fearful to care for these patients. You're going to have staff that could become infected, and then ultimately other patients who are already jeopardized medically in the hospital becoming contaminated, and it's going to be a nightmare.
Well, I tell you, what do you make of the Typhoid Mary scenario that some of these people may be basically immune from it, but may still be long-term carriers, not just for 2 or 3 weeks, but for longer? This could just keep going on and on. If it gets out of Africa, which Ebola's never done because they would never allow people out of Africa that had it, it seems like intentional that they're trying to have a cover story for why Ebola gets into the West.
I think you're absolutely right, Alex. It's that kind of scenario that is very concerning. And unfortunately, people may be, sharing space with these folks already. And unfortunately, with the international travel as it is now and really kind of unregulated when screening for diseases like this, my thoughts are it's already here. And if we do have somebody who's resistant to the virus, then those people are going to be able to go farther and longer without detection. And you're absolutely right about that scenario.
Wow. A lot of medical doctors and virologists are saying that it's much worse than what the CDC or World Health Organization is saying. This top German virologist told Bild Friday that he believes 5 million people from the computer models they have will, and this is one of the top virology facilities in the world, 5 million will die. I don't know. I'm not a virologist. What does that sound like to you?
Well, it sounds conceivable. I mean, it's happened before in our history. So, I mean, if something like the Spanish flu can wipe out gross swaths of population, then absolutely this can. And we're really not prepared for it. I think, unfortunately, a lot of Americans have their heads buried and think they're immune or protected, or it's not going to be me. And that kind of mentality doesn't allow for the vigilance necessary to pick this stuff up early and to deal with it appropriately. And there's going to be people who come into the ER and they're just going to be sent home either with antibiotics or, some treatment for the flu, or and the next thing you know, they're going to go home to their family, contaminate them, and the cycle will continue. But absolutely, if this is truly something that now is possibly airborne, you're talking to millions that could be lost. There's no doubt about that.
Thank you so much for the call, Doctor. It's a doctor in Las Vegas calling in. We have some footage that came out about a week ago. We're going to repost it to Infowars.com because it's so powerful, of a video in a market, an open market in Liberia. Again, if you're a radio listener, go to Infowars.com. We just posted it minutes ago. We're going to tweet it out at Real Alex Jones. And it shows a man who they believe has Ebola trying to get food in the market, basically wandering around with a club in his hand. And people chasing him, police chasing him, and then the hazmat crew showing up and rounding him up to take him basically to a medical camp where people are just, in many cases, strapped down to die now because the medical workers have gotten ill or died themselves. This is really the breakdown of society. We're going to roll some of this in the background for TV viewers to see, but again, you'll want to go to Infowars.com to look at it for yourself. This is just extremely terrifying footage. When you realize that in the human experience, there have been black plagues and Spanish flus and you name it, in some cases kill a third of the population. And it's the civil unrest that something like this would create. And I keep saying this is the season of crises the last year, that it's just going to get crazier and crazier. We have an open border while this is happening, and the politically correct out there say we're not allowed to talk about it. And we have airports just wide open. PBS Nova back in 1990 reported on an airborne outbreak of Ebola. PBS nationwide aired this. We have documents and mainstream news articles from 2 years ago that they believe Ebola is becoming airborne. There have been different strains that have been before, and that it's basically been covered up. Now, again, the mainstream media's response was, we're lying, it's not true, we're conspiracy theorists. Well, here it is from Nova, PBS 1990, a year after the outbreak, reporting on the secret operation. And again, they will probably have all the usual suspects come out and say, none of this is real, none of this is happening. But, of course, it is. Here it is.
In 1989, Ebola made its way to the U.S. Residents of this Washington, D.C. suburb had no idea that one of the world's deadliest viruses had emerged in their midst. In a primate quarantine unit in Reston, Virginia, monkeys in one of the holding rooms suddenly began to die. Secretly, a military team entered the quarantine unit and killed all 60 monkeys in the infected room. The crisis heightened as monkeys began to die in a different room. It appeared that the virus was moving through the ventilating system. In response, the military killed all 400 monkeys, ending the outbreak. This new strain of Ebola had shown the potential to spread through the air. Had it been lethal in humans, it could have been catastrophic.
Okay. So that's one that they don't believe humans get. Now they're saying the type that humans can get 2 years ago in an African lab was spreading in the air. I'm going to say that again. Now that's in the precious New York Times. Something's different this time with this Ebola. And I've interviewed the medical experts, the doctors. I've done my research. I'm no virologist. I know something's going on here. And now they've got vaccines, and Bill and Melinda Gates are involved. Monsanto's involved. It stinks to high heaven. Is this man-made? Is this manufactured? Has this gotten out of one of the research labs in Africa? Has it gone airborne? Well, we know it's spreading a lot faster and dwarfs any previous outbreak. And we know it's part of this season of craziness. And I predict more craziness now, more unprecedented events. You can feel it. It's in the air, pun intended. Let's go to Chris in Nevada, former EMT. Then we'll go to Eric. Chris, thanks for holding. Go ahead.
Well, thank you, Alex, for allowing me on the InfoWars Truth News Central Command Station and calling from FEMA Zone 9 near Las Vegas, Nevada.
Welcome.
This is absolutely a diabolic deception with a specially engineered to be tactically deployed as a bioterror weapon of mass destruction. This full-spectrum spread or rollout, that's the way this administration rolls, to disseminate for a maximum kill rate and depopulation. There was a book several years ago by Dr. Judith Mary Baker called Dr. Mary's Monkey.
Yes.
That talked about the Centers for Disease Creation and Control's secret weaponized disease.
Oh, we sell the
lab.
book, and she worked in the bioweapon lab, and there was absolutely weaponized cancer, all of it.
Well, recently there was a movie on TV that was very suggestive and on point. I think it was called The Immigrant, showing Sharon Stone. And the line that I recall specifically from that movie is, the best mule is a mule that doesn't know it's a mule.
Ah.
This is absolutely demonic is what's going on, Alex. You know this.
Well, you notice they've got Al-Qaeda running all over the world. They've got open borders, the dollar. They're starting wars with Russia. Every number we see just shows they're just turning all the global meltdowns, all the global crises loose. And I've been saying, what's the next shoe to drop? I said this months ago. Is it a bioweapon? Is it a new war? Well, I mean, what do you think the next shoe to drop is? A huge terrorist event in the U.S.?
I think it's likely all of the above. This group has never done one thing with one purpose. It's always multifaceted in every scam they put forth on the American public as the domestic terrorist revolutionary occupation force that are sitting within the government. They always have multiple different aspects to their plans and likely will employ multiple different asymmetric styled attacks around the nation in different locations to get the maximal effect of invoking fear into the public.
Wow, look at that headline. Ebola, AIDS manufactured by Western pharmaceutical companies, U.S. DOD. Scientists allege. Wow, what is that out of? The Observer? Daily Observer, yeah. Yeah, that's a Liberian publication.
Celebrate the spirit of freedom and liberty upon which our nation was founded at InfoWarsShop.com. Molon Lave is ancient Greek for come and take it. This popular design combines both classic Greek Spartan imagery with modern M16 assault rifles. Now available in women's tees and proudly made in the USA. Celebrate the spirit of 1776 with the George Washington brass belt buckle or this incredibly sharp-looking 1776 hat. Badass. And be sure to check out the new arrivals at InfoWars Life, where you can prepare your body to perform at peak levels with Survival Shield Nascent Iodine, Super Male Vitality, and Fluoride Shield. And wake up, America. Immune Support Blend is the healthy choice for the gourmet coffee lover. So get incredibly high-quality, freedom-based products and help fund the revolution at InfoWarsShop.com.